Hi, parents. If you're watching this, you're likely navigating one of the most challenging decisions a parent can face, whether or not to medicate your child for ADHD. First, I want to start by saying that this is not an easy decision, and whatever path you're considering, you're doing so because you deeply care about your child's well being. This video isn't here to tell you what to do, it's here to provide evidence based information to help you make an informed decision that's right for your family. I'm going to talk about the potential outcomes for individuals with ADHD who go untreated or unmedicated. We'll cover the increased risks related to substance abuse, financial difficulties, higher rates of accidents, academic performance challenges, and self esteem issues, all backed by scientific research. Let's start with substance abuse. A significant concern for many parents is the fear that ADHD medication itself could lead to substance abuse. Interestingly, research shows the opposite may be true. A study published in the journal Pediatrics found that individuals with untreated ADHD were at a significantly higher risk for developing substance use disorders compared to those who received ADHD medication. In fact, the study showed that treated individuals had a 1.9 times lower risk of developing substance abuse problems. This suggests that appropriate treatment, including medication when recommended, may actually reduce the likelihood of substance abuse later in life by helping manage the impulsivity and poor decision making often associated with untreated ADHD. Next, let's talk about financial stability. ADHD doesn't just affect behavior in childhood, it impacts academic performance, job stability, and financial management well into adulthood. A large scale study published in the Journal of Economic Perspectives found that adults with untreated ADHD had significantly lower income levels, higher rates of job turnover, and were more likely to experience chronic financial stress compared to those without ADHD or those who had received treatment. This isn't just about having trouble balancing a checkbook, it's about struggling with the executive functioning skills needed to maintain steady employment, manage expenses, and plan for the future, skills that can be supported through effective ADHD treatment. Next, let's discuss safety. A meta analysis published in PLOS One examined data from over 17,000 individuals and found that people with untreated ADHD had a significantly higher risk of accidental injuries, including car accidents. The research highlighted that individuals with ADHD were about 50% more likely to be involved in serious accidents compared to those without ADHD. However, here's the crucial part. The study also found that the use of ADHD medication was associated with a substantial reduction in the risk of accidents. Why? Because medication helps improve attention, reduce impulsivity, and enhance decision making, all of which are critical for tasks like driving. Academic performance is another area affected by untreated ADHD. A study published in the Journal of the American Academy of Child and Adolescent Psychiatry found that students with untreated ADHD were more likely to have lower grade point averages, increased rates of school disciplinary actions, and a higher likelihood of repeating a grade compared to their peers. ADHD impacts attention, organization, and task completion, all essential for academic success. However, the study also noted that treatment, including medication, behavioral interventions, and academic accommodations, significantly improved academic outcomes over time. I do want to mention that ADHD medications were not designed to be academic performance enhancing drugs. If a prescriber tells you that your child doesn't need medication because their grades are fine, please share this video with them, as the research citations are also included at the end of this video. Lastly, let's talk about self esteem. Children with untreated ADHD often face repeated criticism for behaviors they struggle to control, which can take a toll on their self confidence. As a former school social worker working at schools for students with behavior challenges, I cannot tell you how frequently I saw that with children with ADHD who were unmedicated. Research published in European Child and Adolescent Psychiatry highlighted that individuals with untreated ADHD are at a higher risk for low self esteem and emotional difficulties. This can contribute to feelings of inadequacy, anxiety, and depression as they grow older. When ADHD is effectively treated, children often experience improved self esteem because they gain better control over their behaviors, perform more successfully in school, and have more positive social interactions. I know this information can feel overwhelming. The goal here isn't to scare you, it's to provide you with the facts so you can make an informed decision. ADHD is not just about attention, it's a condition that can affect nearly every area of life if left untreated. But the good news is that we can have effective treatments, and medication is one of the tools that can make a significant difference. That said, medication isn't the only option. The American Academy of Pediatrics evidence based recommended treatment for children with ADHD over 6 is parent training, which I provide to families in more than 50 countries through the ADHD Dude membership site, in conjunction with medication management. For children under 6, the recommended treatment is parent training first, followed by the use of methylphenidate if necessary. School supports, if warranted, are also a recommended treatment for all students. Please note that talk therapy, play therapy, and other forms of counseling are not included in the American Academy of Pediatrics treatment recommendations. If you feel unsure about medication, I encourage you to speak with your child's healthcare provider. If they don't seem well informed about ADHD medication, which may be the case, you can also speak with a psychiatric nurse practitioner or physician's assistant who works in pediatrics. Bring your questions, your concerns, and this data. It's okay to take your time and revisit the conversation as needed. I strongly encourage you to stay away from seeking medication advice in Facebook parent groups or in Reddit, as in my experience, they tend to be full of misinformation and disinformation about ADHD medication. If you find this video helpful, please like, subscribe, and share your thoughts in the comments, and please make sure to check out the ADHD Dude membership site as well. Remember, you're not alone on this journey, and we're here to support you every step of the way. Take care, and remember, you're doing a great job even when you doubt yourself. I'll talk to you soon.